enzymatic disease, I told you, right? And it is something which defies diagnosis. It is very difficult to diagnose endometriosis very quickly because every one of you know that whenever you started off your periods and if you had some pain, it was told to be something to be acceptable and okay to be with because pain is supposed to happen with periods. Now, endometriosis pain is very unlike your regular pain that you get with your periods. This pain is pretty severe, longer lasting, and very often ignored because pain is supposed to be something which is normal. So here is where pelvic examination helps. Now, what we do is when we have a patient who's complaining of pain, sometimes ultrasonography, which is done generally for looking for cyst in the ovary or endometriosis, is completely missing the whole point. But we do an internal examination. So we actually examine with our fingers to notice what is the orientation of the uterus, where is the intestines adherent, urine bladder adherent, and we are able to make a judgment about where endometriosis is, where it is stuck, whether it is stuck, it is not stuck, things like that. So that is one key area which actually helps us to diagnose endometriosis where everything else fails. So a patient is coming to me with pain but has a normal ultrasound, and when I examine, I feel the painful nodule. So then I know I'm quite confident to tell the patient that yes, this examination is telling us this is there, and I'm sure the only way to diagnose it correctly would be put a telescope inside and have a look. But for sure, that shows endometriosis to be present. So pelvic examination essentially is examining with your with your fingers. So that's where I said there can be these little. So that comes in a grade one endometriosis where there is these small tiny dots. Sometimes when you're doing a laparoscopy for a patient who's infertile, who's not able to conceive, and you do a laparoscopy, what you see is that there are small little dots of powder burn lesions, we call them. So it's like a matchstick burn thing. There's a little black dot and whitish fluids around it, or there could be bulbous watery fluids around it. These are all small incisions seen around the uterus. They are not involving any organ per se, but they are around in the peritoneum, around the covering, the lighter covering around the uterus. It is seen over there. That's called peritoneal lesions. And endometriosis symptoms, first of all, needs a good diagnosis. So, most often across the world, the data suggests that it almost takes up to 4 to 6 years for a diagnosis of endometriosis to come through. So, it is that difficult to diagnose simply because pain is something that is accepted by the world, around the world. People just accepted that periods should have pain, which shouldn't be the case, but that's how it has been. Thankfully, now we are having all these awareness initiatives, so we should be able to enlighten people, enrich people about this knowledge that no, pain is not something which is normal. Having said that, when you are looking at getting a patient, what can she do to prevent it? Well, once you have endometriosis, getting yourself diagnosed is important. So, if you're having pain, make sure you get yourself checked out very correctly. There is nothing as such in lifestyle that can be done to prevent it. However, avoiding things which are inflammatory in the body in your diet can be modified to reduce your pain. Instance, leading an active lifestyle, where doing some amount of cardio workout every day will help also to reduce your symptoms to some extent. So these are things you can do. But frankly, if you have a family history of endometriosis and you are having pain, there's very little you can do to actually stop it from growing anymore, except for taking treatment. I mean, there are medical treatment, but on your own, you can just keep yourself healthy. That's all that you can do.